came up. I think that was around, I don't know whether that was 2014, 2015. You're one of the people we're talking to back then. So first, just a reminder of what is Ebola and why we should be worried about it.
Okay, thank you very much. And good morning to your listeners and viewers. Yeah, so Ebola is I would say it's a zoonotic condition or disease, meaning that the virus is normally in an animal, and then it gets to man, and then you can have it from man to man. So basically, it's they call it a foot bat. And so when you get into contact with the secretions or the blood of that animal, then you can get the virus in you. So the name of the virus is Ebola virus, but the disease is Ebola virus disease. So, but there are several forms of this Ebola disease. So the common one was the Zaire strain, which is the one that has been common. But this one is a bit different. They call it Bugdio. So what happened was that somewhere in Congo DR, about the end part of April, was a community that were getting people sick and dying, and were doing a lot of tests. All the tests was negative. Apparently, what they were testing was we were testing for the Zaire type of the Ebola, but this one was a different type. So before they realized, a lot of people have been affected and died. But because of the rapidity of the event, and then where the disease is at, it's attention of South Sudan, Uganda, and then Congo DR. And then it's a very volatile area with a lot of rebels. And it's also a mining area. Mining area, people are coming from all over the world. The British said, no, this one, you have to declare it as a public emergency of international concern. So that's how come where we are. So when you have Ebola, normally you have a fever, you have a headache, bodily pain. So it may be like a normal semi-condition. Even in Ghana, it could be like malaria. But this one, the later part, you have bleeding tendencies. So be bleeding for your nose, your abdominal region, and every part of your body. And then that's the hemorrhagic part, and then you die. So it has a very high fatality. So maybe it's about 30-40%. So if you take 100 people who can get it, about 30 will die. So with this current outbreak, we have had over 100 people who have died. So in terms of WHO perspective, they've run the countries in terms of the level of risk. And then the high risk is Congo DR and then Uganda. That's where you have cases reported. And then the neighbors are middle. Ghana is low risk because it's a bit far. But then the WHO is saying that all countries should be vigilant. So what we did was that we started with our first release to alert Ghanaians that there is this outbreak. Though we don't have one in Ghana, we need to be on alert. So we put in a number of items. So one, the disease is a disease of contact. You get it when you are in contact with the secretions or the blood of the infected animal or human being. So in that case, you have to avoid contact. Two, you're preaching hand washing with soap and running water. This is the most cost-effective intervention you can have. It prevents pimples, Ebola, meningitis, cholera, everything. But we are saying that we are going back to this intervention. You know, when at the peak of the COVID, everywhere you go, you have hand washing facilities. So if you look at yesterday's advice of the minister, he's pushing for that again. Because we want to be sure that even if you are exposed, immediately wash your hands with running water. And we're also saying that if you are ill, don't assume that it's malaria. Go to the hospital. So if you look at our response, what we are saying is that we know we all, as you mentioned, we have a plan. But there is a new outbreak with a different strain. So we are updating our existing plan and we look at it at various thematic areas. Development, point of entry, case management, laboratories, risk communication, logistics. So we are updating all of these areas to address this current outbreak. But let me say that Ghana in 2026 is better prepared compared to Ghana in 2014 or 2020. Now, as I speak, we have a number of treatment centers. So assuming we have a contained case in Ghana, we know where we can send it to. We send it to GIDC, we will send it to Global Treatment Center or other treatment centers across the country. And one thing which is good is that we have a laboratory, we have Noguchi, we have a cases here that can confirm cases. So that's the summary of our situation.
Quite interesting. So this is a strain this is a new strain. Is it much more deadly than the first, the Zaire one?
They are about the same. But see, this one, we detected it late. So that's how come the deaths are at that time. But now that we know about it and there are a lot of interventions, I'm sure the death rate will go down.
And the risk levels, you're talking about the WHO assessing the risk levels of various countries. Are we cool?
Yeah. They do risk assessment.
Okay.
And then, so the idea is what is the risk of the infection in your country? So now the high risk country is Uganda and Congo DR. These are the countries that have the cases. Then the next one, what we call the medium, are the neighbors. But then other countries are said to be low risk. But what they have a number of recommendations for the various countries. And one thing that WHO is saying that no country should close their borders. You understand?
Okay.
They are focusing on surveillance systems.
No country should close their borders.
Yes. When COVID came, people were closing their borders. So people could not move. But now, WHO is not saying that. So what we are saying that it's an early stage of an outbreak, and if you put in the right kind of measures, it will not spread.
Are we low risk?
Yeah. So we are low risk, but I mean, a disease can move from one country to the other. That's why we call it health security. Because you see, the disease has an incubation period of about 2 days to 2 weeks or 3 weeks. So I can be exposed and I move from Kampala to Ghana in 21 days and I get a disease. So that doesn't mean that I cannot get a disease within 3 weeks. So what we are saying is that you should have several systems in place that can detect. So you look at it in within and without. So the without is the point of entry. So the idea is that our port health staff should be able to look out for people who are ill and maybe isolate them, and then they will be tested. What we're going to do going forward, assuming the outbreak escalates, is going to introduce the health declaration form. That takes record of every passenger in a plane or a ship, and they will follow you through to the end of your 21 days.
Typically what happens, and you're talking about the fact that we are better prepared. I understand that what happens in this kind of situation is immediately this announcement is made, you put or you trigger your public health management system and put everybody on alert. You're talking about the airports. Are the people, are they told to do what you were just talking about? That when they detect somebody with this kind of problem, isolate the person, test them before any steps are taken?
Yeah. So we had a meeting 2 days ago, and then we calculate what needs to be done. But as I say, you need to scale it up. So we look at the various thematic areas and come to what you do not to do, what you need to do. So several labs. Make sure that case definitions are updated and disseminated. Lab, we need to get a kind of reagent to do the test. And these are the flow areas. So for now, lab, we have 2 labs that can test Noguchi and CVC lab. So we are alerting our system that we prepare a case and you are nothing but of Ghana. Send to cases here. So those are the flow mechanisms that we are sharing across the country.
And when you do an assessment of the risk levels and look at the various structures you have in place, including we the people, where is your biggest problem?
So for now, I'll say the awareness level is low. So we're going to make sure that we broaden the understanding and awareness of people on the disease and what we need to do to prevent the infection. Second one is to make sure that our detection is enhanced. So detection is on two levels: detection at the community level and detection at the health facility. So we are coming out with what we call community alert. What will people look out for? Assuming your village, somebody comes there and he travels from Kampala and comes there. What will people ask for to trigger an alert? So we are coming out for this alert detection that will rent volunteers. So somebody comes to a place and if we realize because it's ill and say he's traveling some place, then we will have to alert the trauma health system. You know those early stages of COVID, you'll be there, somebody will call you. Hey, some guy come from Italy, I bet you to come and take him. So those kind of awareness, we will try and make sure that the community also has an awareness to make sure that we pick diseases early. The emphasis for us is about early detection and response. And we're hoping that we can improve the awareness and the detection across, whilst we beef up our health facilities. But we need to have a lot of PPEs, which makes sure that we have a lot of agents to do it.
Okay, so finally, let me conclude by asking you, for those of us who are not trained, what should we be looking out for whilst we follow the preventive measures that you've proposed? At what point in time should we say, call somebody and say, I think there's a problem here, come and take a look?
Okay, so the early stages, it's difficult to say that you have Ebola because it's fever. And when you have fever, Ghana is malaria. But then the presenting complaint is fever, headache, bodily pains, you have diarrhea, vomiting. The end stage is when you have the bleeding tendencies, when somebody vomiting blood or coughs blood or when you have diarrhea in the blood. That is the stage we don't want people to get to. So what we are saying that if you are ill, and let's say you've been treated for malaria, it's not good. We are saying that no, this could be a pointer for a different kind of disease. This is the time that the doctor will now take a sample and say, would you look at it whether it's Ebola? So the area where we are in, what we are saying is that don't let's assume that we know what is wrong with us. Go to the hospital, let the doctor ask the right kind of questions that will give me a pointer of what it is.
Doc, thank you. Thank you very much for speaking to us.
Thank you.
Dr. FRANKLI ASIEDU BEKOE is Director of Public Health, Ghana Health Service. Now, he says diseases can travel very fast. You recall how one moment COVID was far away from us, the next moment he was in Ghana. Well, that's how fast things can happen. But he said at this point, we are said to be at low risk because the high risk countries, Uganda, DR, Congo DR, and then the medium risk countries are the countries, they are neighbors, neighboring countries. We are a bit far from them, so they say we are low risk. But in this global world, somebody can fly from anywhere to anywhere at any time. So there's a need for you to go back to the things we did during COVID. It's very, very important. And Nancy, please go through all that for us.
Currently, the public is advised to take universal precautions at all times. Individuals must carry their own hand sanitizers and practice good hand hygiene. Event organizers should provide sanitizers and hand washing stations at all events. Now, wash hands frequently with soap and the running water or use alcohol-based hand sanitizers. Ensure hand washing stations are available in homes, workplaces, schools, markets, points of entry and public spaces. Now, obtain information from only official government and health authority channels. Avoid spreading rumors or misinformation that may cause panic. And the last point is that anyone experiencing symptoms such as sudden fever, headaches, muscle pain, vomiting, diarrhea, or bleeding should immediately report to the nearest health facility. Early reporting, they say, and treatment significantly improve outcomes and reduce spread. And so the Ministry of Health and the Ghana Health Service, in collaboration with national and international partners, have intensified surveillance, screening, preparedness, and response measures to protect health, public health. These measures will be updated as the situation evolves. The cooperation of every citizen is essential in preventing the spread of Ebola. Together, we can protect our families and communities. For further information, you are to report. For further information or to report suspected cases, you are to contact the nearest health facility. And this was signed by Honorable Kwabena Menta Akando, who is the Minister for Health.
Well, that's great. So please do take note. It's very, very important. And that's exactly why we are doing this. We are doing this because we know there's a need for us to protect ourselves in this kind of situation. Please listen. Listen to everything they say. Some of you now go and be injecting yourself with all kinds of concoctions and everything, thinking that you'll get out of it. I think the